And elsewhere, the Ministry of Health is cautioning against laxity under the notion that the COVID-19 positivity rate in the country was dropping. Health Chief Administrative Secretary Dr.Rashid Aman is warning counties are recording high positivity rates despite the apparent decline of cases in Nairobi, Mombasa and Kiambu. The caution comes on a day when 151 people tested positive for coronavirus, pushing the total tally to 35,356, while no deaths were reported.
Since the onset of the COVID-19 pandemic in Kenya back in March, the counties of Nairobi, Mombasa and Kiambu quickly consolidated themselves as COVID-19 hotspots. Currently, the three counties account for 70% of the total cases and 80% of the cumulative samples tested so far. However, the tide now seems to be shifting, with the counties of Machakos, Kajiado, Kitui, Meru, Busia and Nyeri appearing to be recording more cases.
We wish to remind our people that we are not yet out of the woods. The pandemic is at different phases of its evolution in different parts of the country. There seems to be rising numbers in some of these other counties. In due time, these counties will also be able to manage those numbers.
The ministry saying that other counties would continue experiencing rising numbers, hence the need for citizens not to lower their guard, as the national tendency in decline was largely attributed to the three counties with more cases.
While the overall curve may be showing progress in a downward trend, when that curve is dismantled into counties, you will still see that there are some counties where numbers are rising, and that is why we are saying we must exercise caution in interpretation of that curve.
According to the World Health Organization, before considering lifting restrictions, a country should ensure there is a decline in cases by 50% over a period of 3 weeks where testing is optimal, less than 5% positivity rate over a period of 2 weeks, decline in the number of deaths among confirmed cases, decline in hospitalization, and that at least 80% of the cases should be from non-clusters.
In our case, we can call Nairobi County, Mombasa County, Kiambu County, which we mentioned, as some of the non-clusters.
On Tuesday, 151 people tested positive out of 2,552 samples tested, increasing the total coronavirus burden to 35,356. In what appears to be a new trend, Kitui led with 54 cases, followed by Nairobi, which had 23 cases, Uasin Gishu 11, Kiambu, Garissa and Migori 9 each, while Kisii had 7 cases.
The ministry continues to support the counties based on a very clear criteria. And the criteria is, one, the disease burden, in this case, the burden in numbers tested positive in those places.
The number of recoveries rose to 21,483 after 173 patients were discharged, out of which 107 were from the home-based care program and 66 from the various health facilities. No fatality was recorded over that period, hence the total remains at 599. Nancy Okware, Channel 1 News.